Hi, so this is my first attempt at making a video here with my webcam. Hopefully I'll be making more of these for my work. So this is just kind of a practice and I thought I'd give it a try. Um, I want to talk today about anxiety. This is awkward, I don't know where to look. I want to talk about anxiety for a little bit. And anxiety is is absolutely the most common psychological issue that's brought to psychologists and therapists. Not only is it the most common psychological, uh, let's say, ailment, it can get to the point of a disorder or a disease when it's severe, but it's actually just so common that it often is present in more mild versions. Social anxiety, anxiety about certain specific events, or narrow anxieties like anxiety about getting into an elevator, which my mom has, or small enclosed places. Or it can be what we call generalized anxiety disorder, which is just very broad based. But it doesn't have to be a full disorder. It can just be feelings of uncomfortableness and how to better cope with it. And fortunately, because it is so common, we actually feel as psychologists that it's probably one of the easiest to treat. So I just want to give you a couple tips on how to work with your anxiety. They fall into two categories. One is the mind, and I don't like this division between mind and body, but that's just the way it is. But we have the mind and the thinking part, and then there's the body part. Okay, because anxiety um, really has a magnificent impact on our physiology, which then also then feeds back into our mind as we interpret what's going on. We have a fight or flight response. This would be a keyword to Google to learn more about, as I'll just give you a brief reaction, is that it's a very hardwired response from, we think back to very primitive days. Um, Primitive man saw a threatening animal coming at her or him, and they had to quickly make a decision on whether to fight or fly. And that has with it an incredible amount of what we call autonomic nervous system arousal. So ANS, nervous system arousal, ANS. You can Google that one too. Um, it should pop up if you Google fight or flight. But it's basically increased heart rate, increased uh, release of endorphins and neurochemicals related to anxiety. It prepares your body to be in action. It's a survival mechanism, and without it, we would probably not persist as a species. So it's actually a very adaptive thing. But in our society, there aren't that many wild tooth animals coming at us, other than ones that we're creating with our thinking. So the autonomic nervous system actually slows down digestion, it increases heart rate, and it just creates that sense of nervousness, sweating, all kinds of physiological reactions. Those are in turn perceived by the brain as, oh my God, something's wrong. Time to start getting really worried because we're responding this way, and we believe all this. So the the trick is to start to work with both the body and the mind. Sorry, I have some computer junk going on in the background. Uh, that we need to try to work with the initial thoughts, the fearful thoughts. We call them ants, uh, it's not ANTS, but it's ANTS stands for automatic negative thinking. I'd like to edit that out. I don't know how to work the editing, so that's gonna have to stay. No editing is possible for me yet. So ANTS, ANTS, automatic negative thinking. We Things just pop in randomly. Thoughts about death or thoughts about danger are the most common. If you have a young child, they may be about your child. If you're somewhat obsessive, they may be about germs, like, oh, I'm going to get somebody's germs and be sick or contaminated. Those may run into a different category that I'm not going to address. But we have to recognize that when we get an an automatic negative thought, they're usually something we've thought many times before. They trigger the autonomic nervous system response at rapid heart rate. Your job is to begin to identify the ants. They're fear-based worries that are, you know, I don't like talking about myself in the third person, but I do in this one situation where I say Dr. Geffner's rule is that 99% of the stuff that we worry about, it ain't going to happen. Yeah, that 1% might happen, but really the stuff that's really terrible in our lives we do suffer and things happen. Those things are usually not things that we anticipated or expected or could have expected or anticipated. So coming to terms with the idea that our mind is producing rubbish on a regular basis and is doing so, testing out little thoughts and hypotheses to see, if we need to act on them. And, I don't want you to just dismiss every thought, but recognizing the ones that are repetitive, fear-based, and are unlikely to happen, or that there's nothing you can do about it. There you have it. A lot of the stuff that we produce internally is about social anxiety. How are we perceived by other people? Are they going to think we are foolish or silly? And, those are paralyzing for some people. And I've had to deal with some of that fear myself. Avoiding anything based on fear will always make it worse. You never want to do that. But we're just talking about the thinking part for a few more minutes, and that your task is to start to recognize how they're popping up automatically. You're not going to be able to stop them from showing up. They're automatic. They're automatic negative thoughts. They show up almost out of your control. So don't be discouraged or worried that, they're still showing up and it's been 3 years and I've been working on it. No, that the goal isn't that you're going to necessarily stop them from showing up, although the frequency, now I'm looking at myself on this camera and I'm like, is this eye open and is my, it's really weird for me. I'm sorry, forgive me. I'm blushing and you can see me blushing, and now I'm blushing even more. I'm actually having an autonomic nervous reaction because that's what happens. I've just learned to laugh at it, which is really one of the best things you can do, is to just laugh at it, because they are pretty funny. All of our little fears and worries are so irrelevant, and they're just, if anybody else told them to you, you would laugh at it and you'd say, "Oh, why are you worried about that?" But it's because it's coming from you, and we believe what we think we are thinking, that it's going to be truth. Like I said, say a lot, is that if, it only was like in a different voice. If it sounded like Minnie Mouse or Mickey Mouse and it was like, "Oh, you're blushing and now everybody's going to think you're stupid, and, and oh, your eye isn't quite open, maybe you've had a stroke," if it sounded like that, then you could dismiss it. But no, it sounds exactly like Eric, talking to myself. And because when Eric says, "Eric, you need to go to the bathroom," I will listen to that. You have to, but a lot of times it's wrong. It'll say, "Eric, you're hungry." I'm not hungry. I'm thirsty or tired. But it's saying you're hungry. You're not. You're bored. I'm bored. But because it's in your voice, when you are talking to you, you tend to believe it, even if it's complete and utter bullshit. So we stamp out the ant, not to sound like a real, cliche, but we stamp out the ant by calling it bullshit or whatever phrase you want to use. Personally, there are major techniques learned to learn how to become mindful. So another key word is mindfulness and mindfulness training, and there is a zillion YouTube videos on how to increase mindfulness. I think if you have an anxiety issue, that you definitely want to use those tools. They're the ancient wisdom that are practical in today's terms. And so, working with your mind is the uh, kind of the first area of attack. And that could be, I could talk about that for another hour, but or a hour, I should say, because it's only been 10 minutes. But I'm going to try and keep this brief. And so that's a huge focus of work. The second focus of work is physical. And it's very counterintuitive in a way that that's maybe not true, because maybe it is intuitive, that you really need to relax when you are having panic. It's counterintuitive to your brain and your body, because your brain and your body are all fired up and they're ready to go, and they're nervous and anxious and producing the autonomic nervous system response, which is distressful. But your job is to calm it down, is to get the opposite, the parasympathetic reaction, which is the calming response. And there's a zillion ways to work on this, including mindfulness, the mindfulness techniques. And these are equally important to learn. And they're pleasurable too. So now it does take, when you have an anxiety, if you don't catch your negative thinking quickly and it gets into the autonomic nervous system arousal, it will take between 5 and 15 minutes for your body to calm down. It's just, once it starts up, you just can't, the train is left the station and it's chewing down the track, and you put the brake on and it's still going to screech for a while. And so you have to recognize that it's not instantaneous relief, but you can start to make a difference and speed up that process dramatically. The better you get at these techniques, the better equipped you'll be to deal with your anxiety when it arises. You can even start to use the techniques to calm your autonomic nervous system down. Once you have an ant, you go like, oh, there's a negative thought. Deep breath, relax the body. Even if you didn't have a full-blown anxiety attack, you could nip it in the bud, so to speak. Preventative, chopping it off at the head. So, boy, I'm just full of cliches right now. All right, so how do we use these techniques? Let me just break them down for you. There's so many. Breathing techniques, and there's tons of those. I do not recommend doing much other than watching a couple of breaths, 1 or 2 deep diaphragmatic breaths. We'll talk about that for a few minutes. The relaxation of the musculature. So here's another key thing to look up on Google, or actually YouTube probably, for these terms. Like mindfulness would be better on YouTube, I think. I would look up progressive muscle relaxation, with a warning that I'll give you in a minute about some techniques that aren't helpful with progressive muscle relaxation. So we have breathing techniques, progressive muscle relaxation techniques. Another category of intervention techniques is to have a calming phrase or sound. So that wouldn't be exactly a body, that would be more of a mind way to work with your mind. Some of the most basic chanting, meditative sounds like Om, Om. When I'm trying to calm down, I like to stretch out the Om part, and really just get into the vibration of that sound. Can trigger relaxation if you've used it a lot and practiced it, just sitting and saying Om, 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 Om. You may want to put some little pieces of cotton in your ear or tissue just to hear the vibrational sound of it at first, if you're not somebody that's used it much. I like using mantra, chanting and mantra, and there's a ton of that stuff on the internet. To just type in mantras and find one that you like. Any religious mantra can work, or non-religious mantra. A non-religious mantra would be, you are relaxed and at ease. You are relaxed and at ease, or you are relaxing and at ease. It's critical that you're able to find a phrase that you like, that works for you, that's reassuring and calming. You want to reassure yourself like a mother would reassure their crying infant, or a father would reassure their crying infant. You know, how would you reassure yourself that you're okay? Because you are. You're going to be okay. You know, even if something bad happens, you're still going to make it through. You know. Okay. So we have these techniques, and these techniques are best practiced when you don't need them, so that you have them ready. The breathing technique that I use is just simply mindful breathing. It's just basically I close my eyes, which I don't do anymore. I will mostly try to do it with my eyes open, because I think that we can't close our eyes if we're having anxiety when we're driving, or we're public speaking, which is hideously terrifying for me at times. You know, I can't just be like, okay, I'm going to talk about my lecture today. No, actually, if I get nervous while I'm speaking, I actually own it. I'll say, hey, I'm a little nervous, you know, just give me a couple minutes here. I have a terrible cold right now, so my breathing sounds like Darth Vader. But we just watch a breath come in from the nose and leave through the mouth. It's simple. I don't do anything fancy. And just watch the whole breath from the beginning, the middle, and the end of the inhalation, the beginning, middle, and end of the exhalation. And if you can sit and do that for 5 minutes, which I'm not going to guide you through it right now, you'll find a profound relaxation from just 5 minutes of watching your breath. Real easy. I don't have the attention span for much more than that. I'm not going to sit and do it for 20 minutes, even though a lot of people recommend that you practice for 20 minutes. No, just practice for 3 minutes. Actually, if you can just watch 5 breaths in their entirety from the beginning to the end, you'll have a serious autonomic nervous system relaxation, which we would call the parasympathetic response. If you're congested like I am, you can just watch it from the lips. You focus your mind on your lips as you watch the air coming in and out. I like the tip of the nose best. There's all these very complicated systems for breathe in 3 times and breathe out more than you breathe in, and all of this, and I think that 99% of it is not necessary, especially when you're dealing with anxiety. The one thing that I'd like to recommend for you is that you breathe from your diaphragm, so that you take these breaths of mindfulness, and it's just that it's coming from, you can't see my hands here, it's coming from basically your diaphragm, which is just a few inches below your belly button, so that your diaphragm moves and it's not just shallow. See, when you're getting the autonomic nervous system fear reaction, you're going to have shallow breathing. It's going to be short and not deep. So just by making it not like, you know, you don't need a big deep breath. You just need a little short, shallow. I mean, you need to stop the short, shallow breathing. You just want to make the breath come from a deeper place in you. It's not like you're taking a big breath. You're just taking a deeper breath, and that's something people misconstrue a lot. Moving over to the most important physical intervention, which is called progressive muscle relaxation. And again, you want to find some of the YouTube videos. Make sure that the YouTube videos don't involve clenching and tightening excessively. This is a technique that was taught in the 1950s to stressed out 1950s, business executives. I was lucky enough to learn from the man who invented the technique, named Edmund Jacobson. I didn't learn from him, but from one of his students who learned it directly from him. And this technique involves relaxing your whole body. So there's a body scan, and you start, and the quicker you can get at it, in my mind, the better, although learning it is done methodically, where they used to spend an hour on just learning how to relax the face. So basically, let's see, where do we want to start here? I usually start with my patients by teaching them to bend their, see if I can get this on camera, so that, obviously you wouldn't be raising it, but you bend your arm, which is resting on your chair, and you just bend it up with your eyes closed. Okay, and you're going to notice all the tension in the forearm. So So you're gonna have your hand up like this, bent like in this manner, and you're gonna study the tension, and you're gonna start to progressively release it. Now, when I say progressively, I want you to close your eyes and just relax it. Notice the gradual lengthening of this muscle and the release of all the tension in your palm and forearm. And the end result is this. It's floppy. It's like a wet noodle. And you relax that arm very slowly. So it may be, I'm speeding it up here. It may take a couple minutes of that. And then once it's down, you're not done. Well, just because it looks like this, you're still releasing minuscule amounts of tension. And the theory behind this is that muscle tension, clenching your jaw, your teeth, depressing your teeth and your tongue, that creates a lot of signals to the brain that something's really worrisome. You're going to go through your body, and I'll just do an example. You relax your jaw. You let your jaw hang loose. You make sure the teeth are not tightened. It's hard to do this while I'm talking, but you relax your jaw, all the tension. So if you're not sure what tension in the jaw is, you touch your teeth together for a second and study the sides of your jaw. And you can feel the tension along what we call the masseter muscle. Now release the masseter muscle tension. Let the jaw hang open and loose. The tongue is relaxed in the mouth. It's not pressing. It's not curled. The eyes are closed, but they're not pressed closed. They're just gently floating closed, really relaxed. And I'm going to open mine up, but you can keep them closed. You relax your forehead, all the muscles in the face, the cheek. This would be 20 minutes of work if I was teaching it to you in a session, but for the sake of expediency, and who has that kind of time anyways, we relax the shoulders, relax all the musculature in the shoulders. You should feel them drop substantially. You can time the relaxation of a body part with breathing out. So as you breathe out, you can go down the body. You're scanning the arms now, the upper arms, the lower arms. As you breathe out, you can release tension in the upper arms and then the lower arms, moving through the torso, the throat, just all the way through the whole body, even the organs, relaxing all the internal organs. There may be tightness in the stomach, and you want to be able to do this really rapidly when you're in an anxiety situation. So again, go to the YouTube videos, look for progressive muscle relaxation, look for mindfulness, look for breathing. But I don't want you to do anything that creates tension. So if the progressive muscle relaxation says, okay, now tighten your fists and make a fist, and a lot of them do that, and it's wrong. Based on the way I was taught by the guy who invented the technique, well, by his teacher, by his student. Just create a little bit of tension, like when I did that with the forearm. That is creating a lot of tension in your forearm. Believe it. If you don't feel this creating a lot of tension in your forearm, then you're not really noticing what's going on in your body. Because what we normally do in the treatment is you connect biofeedback monitors we connect biofeedback on there, and we show people what's going on, especially when they have chronic pain, because this is all treatment for chronic pain. Anyway, so that's just a little overview on how to work with your anxiety. I'd be happy to explain any of the situation, any of these things in more detail. If you have any specific questions, just let me know. Thanks for watching. Bye now.